It is a big question. Where should South Carolina's limited vaccine supply go? South Carolina lawmakers want to change where vaccines are sent, and their proposal was included in a vaccine relief bill passed by the House this week. Our Jason Raven tells us more.
Instead of sending the vaccines directly to the counties, South Carolina lawmakers want to send the vaccines to the 4 regional areas and then be distributed there based on certain factors.
The rule calls require an order. We'll vote on the board.
The House passed a bill that provided some additional funds to help with the vaccine rollout. It also included a proposal to change how the state allocates vaccines while demand continues to outweigh supply.
We can't produce the vaccines. We can't get them here any faster. But when they get here, we can make sure they're getting into the arms of the citizens of the state of South Carolina rather than having logistical roadblocks.
Now, right now, DHEC is allocating vaccines to counties based solely on population. The lawmakers want them to send these vaccines regionally, like the Upstate, Midlands, PD, and Low Country, and consider certain factors before sending the vaccine to where it needs to go.
It doesn't take into account the poverty in the rural and underserved areas where people can't drive to one county or the other. It doesn't take into account what providers are in those actual counties.
Those factors are poverty level, infection rates, age, and high-risk population. Now, lawmakers say they want to make sure the rural, underserved areas in South Carolina aren't left behind.
When we talk about economic progress, when we talked about education, anything else, broadband, the rural areas, they were suffering, okay? So they should be put as a priority.
Now, the bill also creates regional advisory committees that would meet with DHEC once a week to give them recommendations on where to send the vaccine. Now, the bill is now on its way to the Senate for debate and a possible vote in the coming weeks. Right now, states receive vaccines from the federal government based on population. From the State House, Jason Raven, 7 News.
State health officials say they expect the weekly allotment of vaccines that South Carolina receives to increase by 16% or 10,000 doses very soon.